Good afternoon. I guess we're almost there for those on the West Coast, East Coast, and for those here, we're still sneaking in the morning. It's a pleasure as you think about the journey. Thank you, Sue, the whole crew here, that this committee has been on to kind of be the last of the panelists. I don't know if that's a good or a bad thing before we get to our final commentary, but I do want to start the conversation and the time that we have to tie this all together. And I am so inspired by the voices we heard today, from Dr. Beard getting to the reality of what we're facing in life today, to Nurse Stefan's reality that we have to translate our work in healthcare to the reality of the people that we serve, to the folks that we just heard about in elevating compassion in a way that actually turns to action and wellness for our organization. So my hope is to tie this all together in a way through a bit of evidence and a bit of story as well. And you know, we use a lot of Maya Angelou quotes in healthcare, and there's one in particular that sticks out to me, and she says this, you know, if you find it in your heart to care for somebody else, you will have succeeded. And this effort that we put in healthcare each and every day is about the caring for one another. So when I think about the opportunity that we have in the future of nursing, when I think about the honor that I've had to work with the nurses that I've had the chance to work with, it reminded me of a story not too long ago when I was visiting a hospital in Sao Paulo, Brazil. And I was told the story by a gentleman, a husband, who said, unfortunately, his wife was in her last days of life in a palliative care unit in the oncology section of the hospital, and she knew her daughter's 5th birthday was coming up. And so she asked the care team, is there anything that you can do to ensure that I don't pass on my daughter's birthday or before her birthday? And so they did everything they could. The care team came together. They worked with everybody in that situation. They brought that family together, and they were able to extend the life of that mom, and they were able to bring that daughter into the hospital, and they had a birthday party for her, holding her mother's hand. Now, the father told me that a few days later, the daughter pulls on his shoulder and says, "Dad, I want to go back there." And he said, "What do you mean there?" She goes, "To the hospital." And he's like, "I don't want to go back to the hospital. That's where we lost Mom. Why would you want to go back to the hospital?" And she said, "Just come with me, Dad." The wisdom of 5-year-olds, right? And they walk into the hospital. She finds this nurse, Veronica, there, who I'm standing next to, and she says, "I just wanted to say thank you. Thank you for my birthday party. But I want to tell you something important. I decided what I want to be when I grow up. I want to be a nurse." You see, when we create environments of caring, when we create environments of opportunity, when we create environments of well-being, we create the future of nursing. All the tactics and evidence and everything that we talk about help us get there. But that little girl is the future of nursing. That little girl's aspirations, the way we cared for her, is. And when we think about what that means, see, care is not just something that we do. Care is really an action that we think about. It is to feel interest or concern for. It's living in that every day. I think we saw it and heard it evidenced in everyone's conversation. And it really is about the essence of what I believe healthcare is, that when we think about healthcare, it's about human beings. Let me ask, I know we've been listening to a lot of speakers. How many people here are human beings? I won't get into a story about where I went in that question, did not get that kind of reaction, but the essence of healthcare is simply this. We are healthcare. We are human beings caring for human beings. And when we begin to think about that, then I think we have to think higher than just the evidence and the tactics. We have to think aspirational. And this isn't that picture, I think, that Nurse Devin was talking about, like, hey, we can all climb the mountain together. We have to understand that this is a mountain. This is work. We walk up it every day, and we don't know what's over the top. But our opportunity is to really step further into what is possible over the top. You know, from our aspects, from the Beryl Institute, we've worked to try to focus on expanding the discussion by building, in essence, a field of practice around what it means to generate experience for people in healthcare. Through the idea that through every interaction, based on the culture of organizations, we can actually build an infrastructure to bring people together and have a conversation. But going even further beyond research or certification or the evidence that we talk about, to think about how we integrate healthcare, how we integrate experience in a way that matters, and helping people see that all the work that they do each and every day matters. It's not just one simple thing, but it's this integrated effort that we pull together each and every day in our work. And so for us, even elevating the conversation is more important. And we think about this idea of human beings caring for human beings, that we ultimately are working on something much greater. We're working on the opportunity to change healthcare with an unwavering commitment to elevating that human experience. And when we heard everything that we heard what Bernadette was speaking about, that when we understand well-being is potentially the biggest pebble in our shoe in healthcare, the thing that's going to cause us the greatest pain, the greatest opportunity for error, and potentially the greatest demise of what we try to do every day in creating caring, we have to figure out what it takes to elevate that human experience in our work each and every day as well. Now, I want to ground it somewhat in evidence because I agree in God we trust, but we need a little data. But I think we need a little story as well. And so we had a chance in the last year or so to do a couple inquiries. One, to talking to consumers of care. What matters to the patient? And I think it was important we brought their voice into the room as well for this conversation. So what matters to those people that are engaging in our healthcare system each and every day? And what they told us was, number one, the experience we provide them matters. But it wasn't just nice, yes, the experience is extremely important to me, or very important to me. It matters for something much more deeply. It matters because what they told us was, it's about my health and well-being. When consumers of care are telling us it's about their health and well-being, what they're telling us it's got to be about your health and well-being as well. It's about that I want to be treated with dignity and respect, which means we need to treat each other with dignity and respect. And ultimately, it's about the fact that I'm going to make choices, and I think we heard it in every conversation today. People in healthcare are finding new ways to engage with us and different ways to engage with us than models of the past. And if healthcare as a system doesn't evolve to address what people's needs are and the reality of the worlds in which they live, then we are going to be left behind for new ways of delivering care in ways that we can't even imagine. You know, so when we think about this idea of focusing on health and well-being, we ask consumers what really drove their thinking as well. And what you'll see is this: listen to me. When we heard, I think, so graciously, Dean Beard's story about the fact that in a way, we didn't listen to that little girl's story. We missed the parts that mattered. And to be able to care for somebody in a way that we not only then can communicate in a way that they understand what we're talking about, but that we also treat people with courtesy and respect, that we find the compassion, as Tim was talking about, to enable them to do the greatest things, and then ensure quality, right? We have to give patients and families confidence in our abilities as well. Because when we asked those consumers of care what mattered to them most, what ensured they had the best in their own human experience, what word do you think popped out? Caring. They expect us to get all the work right. They expect quality. They expect safety. They expect expertise. And if we build a plan simply on being better experts or higher quality, we have missed everything that the consumers of care are asking us for. That is fundamental, a given, the foundation on which we build. But if we don't think about a system that pushes us to think about this differently, then we are probably leaving ourselves behind in the conversation. So we dug a little bit deeper and we asked high-performing healthcare organizations what mattered to them. What drove their outcomes? What made a difference for them? And as we looked at both general healthcare providers and practitioners across roles and across segments of the healthcare system and in high-performing units, here's what they told us. Not unlike what consumers said, yes, you need to communicate with me. You have to engage me. You have to ensure that you hear what I say. So all the things that were important to what we heard from the consumers of care were what those units that believed they were delivering the best in human experience said was essential to what they were doing as well. But look what came next. Look what they said was next in importance for them to be able to drive the best experience for those they cared for and served. We had to be engaged as a team. We had to take care of our team. We had to focus on clinician and clinical team well-being. This is not just a nice conversation. This is what the people on the front lines of care are asking us to talk about. And so thank you for adding this to the program, because if we're not talking about just the simple application of technology, the simple application of all the evidence we've heard about in Chicago earlier and in Philadelphia a few weeks ago and now today, that we're being told we have to go a little bit deeper. And I think when we think about this idea of being aligned about well-being, then it has us think about healthcare and maybe thinking about what the future of nursing can be in a different way. You see, we have built a healthcare system that has been pretty much transactional. One transaction to the next, to the next, to the next, to the next. And we've tried to kind of stick these little relational moments inside there to make it feel more human. That's not going to continue to work for us. Solutions of making healthcare more human is not going to get us there. What we really need to focus on is creating a system that I believe is more relational, that the transactions are the synapses between the relationships that we build. The opportunity that we have to shift healthcare is what enables us to do that overall. And to me, at the end of the day, with all the evidence, and I'm a researcher, and we love our sample sizes, the biggest sample size that I have found that matters in any healthcare encounter I've been part of or been, enabled to watch is this sample size right here, the N of 1. When we begin to think about that N of 1, the ripple effects, the opportunities of that N of 1 are pretty substantive. And it helps us begin to think again about how we change this commitment to human experience. See, what we heard in the first panel today was human experience really is about the social determinants of health. Human experience is about the things that we learned when you look at data sharing and cross-sector data sharing and that opportunity for us to understand what matters to each other, that we can make the best decisions. It drives access and equity. It enables us to ensure affordability and ultimately health, not just the treatment of illness. And it gets us beyond this idea of just technology for the sake of technology. And I love the fact that we got to hear that from all the folks that are addressing technology as well. We've been fortunate enough just to put out an issue of Patient Experience Journal this last few weeks on the idea of innovation and technology in healthcare. And what we said was basically this, that we have to focus on the fact that healthcare helps us realize efficiencies, but also helps people in healthcare understand the benefits. But we cannot ensure that healthcare, the technology gets in the way of our ability to elevate a broader conversation in the human experience. We use technology to improve touch. Because again, I think our largest and most important workforce in healthcare today, right, is our nursing workforce. And this is a crew in the mother-baby unit at St. Joseph's Health in Paterson, New Jersey. That was where I was born. And I had the honor to go back to them and visit them for my 50th birthday. It was the best birthday song I ever got. And in fact, the nurse that was there just retired 2 weeks before I showed up, came back to give me a hug and said, "Welcome home." See, when we think about what nurses do, when we think about the resilience of the front line of care, and we don't take care of these people each and every day and build systems that do that, then we miss the opportunity of what we're trying to accomplish here overall. It's how we use the data, how we use the technology, how we elevate compassion, how we ensure wellness and mindfulness that makes a difference. You see, I believe this, fundamentally. If we do not ensure that people feel human in healthcare, how can they ever be human? And so when everything that we heard about, every question we ask ourselves is about that capacity and about our ability to elevate that conversation in a way that enables us to elevate that humanity and care overall. I had an honor actually just to release an article in Nurse Leader, came out on Monday, and we talk about something that's very important, about the opportunity to create an environment, in particular in nursing, and for nurse leaders to think about 4 elements of what we can do for our teams, for those that we care for, and for those who provide care each and every day. That we have to create environments of listening and not just hearing what people say, but actively engaging in what matters to them. Hearing them and understanding in a way that enables us to act effectively. That we have to communicate and not just say things, but communicate in a way that people can understand. You know, when we think about the situation that we just heard, honestly, from Bernadette's mom, if maybe we had communicated differently in a way that she understood, that prescription would have come out of that purse, and her life would have been extremely different. So when we don't communicate, when we don't do our job in a way that people can understand, we miss that chance as well. That we have to be present. That the chance to be there for those that we care for and serve is fundamental. The idea that we have to make the space then to have those conversations, to listen to our staff, to feel their pain and then address it in a way that matters is what helps us ultimately move this conversation forward. You see, to me, it's about elevating that conversation on human experiences, our opportunity as we think about future of nursing. So I would just kind of challenge the committee, and I would challenge all of us to think about this in some unique and in different ways. I think first, we have to educate healthcare leadership and support policies that encourage that. That will help us drive quality outcomes and ensure the best in practice. We have to create processes and guidance to ensure nurses can focus on the human experience that they sought to provide. When we get in the way of that capacity, we actually drain purpose. When we enable that to happen, we ensure purpose. We address the issue of burnout and address the issue of resilience. And ultimately, we have to build development programs, and I think we heard this from a lot of people, to build new perspectives for nurse leadership that can help them drive the outcomes. I think expanding the capacity of our healthcare system to do what matters. So when we begin to think about what that means for us, if we want systemic solutions, we must take a systemic approach, not just lists of things to do. We cannot simply treat the symptoms. We have to get to the cause, as we heard this morning. And so I was just told a story recently about a nurse, a patient was lying in the bed, I know I have about 20 seconds, so it's perfect. The patient in the bed knew she was a fall risk, reached for a cup of water, knocked the water off her table, and spilt the water on the floor. And she called the nurse, and she pushed the call button, and she pushed the call button, and she pushed the call button, and the nurse came in the room. And as the nurse came in the room, she looked down and saw the spill on the floor, and that nurse walked over to the phone on the wall. Who do you think she was calling? Housekeeping, environmental services. And as she calls environmental services, moments later, you can say you hear the bucket rolling down the hall. And the housekeeper looks at the spill and looks at the nurse and looks at the spill and looks at the nurse and does one of these little finger things. And you know, we've all been guilty of it. What breaks out there in the doorway of this room is the world's largest whisper fight. And what do you think they're arguing over? This is a nurse-sized spill. This is a housekeeper-sized spill. In front of who? Patient, family, roommate, peers, colleagues, and everybody in the hallway. And in the middle of this conversation, all of a sudden they just hear, push. And they turn around and there's the patient, who is a fall risk in the bed, sitting up straight, looking them both squarely in the eye. Pitcher of water that was on her bedside table turned upside down and water everywhere. And she says to them, is it big enough for you now? That's it. That's our opportunity. This is not just a nice conversation we're having, but this is about making it big enough for us now. Because as human beings caring for human beings, I believe that's the opportunity that we have. Thank you very much for the chance to be with you all today.
Thank you, panelists. And now questions from the committee.